Hi, I'm Instructor Pratt with Victor Valley College's EMT program. Today I'm going to be demonstrating bleeding control and shock management skill. So when we first come up to the patient's bleeding, we want to notice if it's venous, dark red oozing, arterial bleeding, which is bright red spurting blood, or capillary bleeding, which is in the middle of those. I'm going to do direct pressure with some gauze or trauma bandage, depending on the size of the bleeding. Going to put direct pressure. If I notice that the bleeding is going through my gauze, I'm going to get more gauze and add that to my pressure. If this continues to bleed through, I'm going to ask that my partner comes in and holds direct pressure while I secure a tourniquet. I'm going to use a triangular bandage as my tourniquet. Going 1 to 2 inches above the wound site. Doing my overhand knot. Second overhand knot. And grabbing my object to twist. Going to tighten until my bleeding stops. Secure my pin. Once my bleeding stopped, I want to secure my dressing. Make sure that my wound is going to be nice and covered. I don't want to cover my tourniquet. I want to make sure that that is nice and visible to all emergency department staff. Once that's done, I'm going to document my time, date, and initials. Time, date, and my initials. Once I'm done with bleeding control, I'm going to notice if the patient's going into shock. The patient will have 7 signs and symptoms of shock that we want to recognize. Increased heart rate, increased respirations, pale, cool, diaphoretic skins, and nausea, vomiting are all signs of compensated shock. Once you start going into decompensated shock, you will see altered level of consciousness and low blood pressure. A sign of irreversible shock will start with loss of consciousness. To treat shock, we want to make sure that we do these 4 things. Place the patient in a supine position. Keep them warm with a blanket. Place them on high-flow oxygen, 15 liters, non-rebreather mask, and transport immediately. That concludes bleeding control shock management skill.